Today I'll be presenting on a case of multiple myeloma in a 55-year-old female, and this clinical study was presented in the published Journal of Medical Case Reports. So first I want to start out with what is multiple myeloma. And multiple myeloma is a cancer that arises in the bone marrow, specifically in the plasma cells. In order to get a good understanding of how this cancer begins its infiltration from inside the bone marrow to outside the surrounding tissue, we got to first understand about the cells that are inside the bone marrow. So first let's look at the white blood cells, which take up 60% of the cells inside the bone marrow, and these are going to be the immune fighting cells. 20% of the cells inside the bone marrow are red blood cells, and these are the cells responsible for carrying hemoglobin, oxygenation throughout the body. 10% of the cells inside the bone marrow are platelets. And these are cells responsible, or these platelets are responsible for clotting. And 1% of cells inside the bone marrow are plasma cells. And these plasma cells are responsible for antibody production. And you can see here that over 10% presence of plasma cells in the bone marrow is characterized as multiple myeloma. So these cells are supposed to maintain roughly 1% of the cells in the bone marrow. When this number rises, it begins to choke out the surrounding cells, and you'll see the symptomology that arises from this later on in the presentation. So first I want to take a look at the side-by-side comparison of a biopsy of a normal bone marrow patient, and on the right you can see a biopsy from a patient who had multiple myeloma. On the left you can see that the red blood cells make up most of the cells in this slide. You can see also the purple cells are the white blood cells. The blue is going to be the plasma cells. And on the right you can see that in the case of multiple myeloma, these plasma cells have become quite large and have begun to choke out the surrounding cells. I'd like to take a look at some statistics from the National Institutes of Health. And according to the NIH, the 5-year survival rate for multiple myeloma is 52.2%. This is data from 2009 to 2015. It's estimated that 32,000 new cases of multiple myeloma arose in 2019. And this cancer is not curable. But for those who survive past that 5-year survival rate, they can live pretty long. Some patients 10 years. And usually these patients are able to live pretty solid qualities of life. Occasionally the multiple myeloma would flare up and treatments would need to be put in place, but most patients can live decent lengths of time with managed symptoms. So I want to take a look at this clinical presentation of a 55-year-old female, and this patient presented to the rheumatology department with a 3-month history of polyarthrasia, which is arthritis in multiple joints throughout the body, joint swelling, a 5-kilogram weight loss, fatigue, and joint pain. And I think it's worth noting that if you look at this symptomology, it makes sense in light of plasma cells beginning to choke out other cells, such as the white blood cells and the red blood cells. Particularly if you look at this fatigue, this would be maybe caused by anemia, which would definitely be a result of the choking out of the red blood cells. The 5-kilogram weight loss, it's pretty common for cancer patients to begin to lose weight, and all of this symptomology was sustained over the past 3 months. So upon examination, the physician found that the patient was pale, cachectic, going back to that weight loss. There was edema, so a fluid buildup in the soft tissue. This patient had a debilitating loss of joint function. This patient couldn't even feed herself when she presented to the clinic. A Tinel and Phelan's test was positive for carpal tunnel, and this is where the physician would do palpitations on the wrist and see if they can stimulate some of the neuropathy that would be felt throughout the hand. Another way, the Phelan's test, is where the hands would be joined together in a downward prayer motion, and the wrists would be pushed down, attempting to stimulate the carpal tunnel symptomology. This patient also suffered from moderate cool effusion in both knees, and this cool effusion is fluid buildup in the space in between the joint and the knee, or the joint, which is the space between the two bones. So laboratory and radiology results pointed to some interesting findings that ultimately led to the diagnosis of multiple myeloma. The first lab test that we're going to look at is the synovial fluid cytology, which is a biopsy of the fluid in the space in between the joint. And this biopsy revealed plasmablasts, multinucleated cells, and chondrolysis. Multinucleated cells, of course, is cells that have become cancerous, and this chondrolysis is a breakdown of the cartilage on the joints. The bone marrow biopsy, taken directly from inside the bone where you have all those different types of cells that we talked about earlier in the presentation, showed that there was heavy plasma cell infiltration, which is again characterized by an over 10% presence of plasma cells. There's also amyloid protein in the blood vessel walls, which could be a result of the plasma cells, which produce this protein throughout the body. A hand X-ray showed there was joint space narrowing, evident of swelling in the joint space. Going back to this slide where you can see the two different presentations of a normal bone biopsy versus a multiple myeloma patient, think about the symptoms that we've just spoken about. They make sense. You can see here that there is much less red blood cells when you have multiple myeloma, which is, in that fatigue is really indicative of that. And you can see that these cells have really infiltrated all these surrounding cells when they normally should make up, when these plasma cells should normally make up 1% of the cells in the bone marrow. So the ultimate diagnosis was multiple myeloma stage 3, and this patient presented with all 3 symptoms of arthritis: erosive arthritis, carpal tunnel, and invasive tumoral arthritis. And it's interesting because in most patients, these comorbidities of multiple myeloma are discovered after the cancer. But in the case of this patient, because she was so progressed with a stage 3 diagnosis, these symptoms helped to ultimately lead to the core diagnosis of multiple myeloma. The treatment plan for this patient was a triple cocktail combination of chemotherapy as well as an antibiotic. Adrenomycin was used for the antibiotic. Vincristine was one of the chemotherapeutic drugs, dexamethasone, and cyclophosphamide. So unfortunately, patient outcome was not very positive. This patient died 7 weeks after the initial presentation, and this was most likely due to the advanced stage of the cancer. Credit for the information from this presentation goes to Journal of Medical Case Reports, the HealthTree University Myeloma, and Myeloma Cancer Statistics from the National Institutes of Health. Thank you.